One of the hardest conversations I ever had wasn't with a patient. It was with his daughter. She looked at me and quietly said, "He kept saying he'd call you tomorrow." Tomorrow never came. After 35 years of practicing family medicine, I've learned that older adults don't usually ignore symptoms because they're careless. They ignore them because they honestly believe it's probably nothing. They don't want to bother anyone. They tell themselves they'll wait just one more day. And sometimes waiting really is fine. Most symptoms turn out to be harmless. Most aches and pains are just part of getting older and they pass on their own. But sometimes waiting isn't fine. And the hard part is, from the inside, it's not always easy to tell the difference. So today, I want to walk through some of the symptoms I never like my patients to put off. I want to be clear about something before we start. This video is educational. It is not meant to diagnose you or anyone you love. I'm not going to tell you that any of these symptoms mean something terrible is happening. Most of the time, they don't. My goal is simply to help you recognize when something is worth a phone call and when something needs attention right away. Let's start with chest pressure or discomfort. So many of my patients describe it the same way. Not really pain, they say. More like tightness, like someone set a heavy book on my chest. Often they blame it on indigestion or stress or sleeping wrong, and sometimes that's exactly what it is. I remember a man named Robert, 68 years old, who came in 3 weeks after he first noticed a strange tightness whenever he walked up his driveway. He assumed it was his age catching up with him. It turned out his heart wasn't getting enough blood flow during exertion, something we call angina. He was fortunate. We caught it in time to make changes with his doctor's guidance. Chest tightness can sometimes be associated with heartburn or muscle strain. It can also be associated with reduced blood flow to the heart. If it happens with exertion and goes away with rest, it's worth discussing with your physician soon. If it comes on suddenly, feels crushing, or comes with sweating, nausea, or pain spreading to your arm or jaw, that requires immediate emergency evaluation. Please don't wait that one out. Next, let's talk about sudden shortness of breath. Many people notice they get winded doing things that used to be easy, carrying groceries, climbing stairs. Often this can simply be associated with being a little less active than we used to be, or with normal changes in the lungs as we age. But I think of a woman named Carol, 72, who told me she just felt out of shape for a few days. She rested more. She figured it would pass. When her breathing became noticeably harder, even while sitting still, her husband finally convinced her to call me. It turned out fluid had built up around her heart's ability to pump efficiently, something her doctor was able to manage once we caught it. Gradual shortness of breath that develops over days or weeks is worth scheduling an appointment for. Shortness of breath that comes on suddenly, especially if it's severe or paired with chest discomfort, needs emergency care right away. Now let's talk about one-sided weakness or numbness. This one worries me the most when people wait, because time truly matters here. A hand feels clumsy, a foot seems to drag a little, a smile looks slightly uneven in the mirror. It's easy to convince yourself you just slept on it wrong. I think of a retired teacher named Frank, 75 years old, who noticed his left hand felt strange while making coffee one morning. He thought maybe he'd pinched a nerve. He decided to see how he felt after lunch. By the time his son arrived to check on him, several hours had passed. Every minute matters greatly in situations like this, because timely treatment can make a meaningful difference in outcomes. If you or someone you love suddenly experiences weakness, numbness, or drooping on one side of the face or body, sudden confusion, trouble speaking, or sudden vision changes, please don't wait to see how you feel later. Call emergency services right away. This is one symptom where "I'll see how I feel tomorrow" can cost something precious. Let's move to something a little more private, but just as important. Black or bloody stool. I understand this isn't easy to talk about. Many of my patients feel embarrassed even bringing it up. They assume it's from something they ate, or hemorrhoids, or they simply hope it goes away on its own. Sometimes it genuinely is something minor. But I remember a gentleman named Walter who noticed dark tarry stools for almost 2 weeks before mentioning it, only because his wife insisted. It turned out he had a slow bleed that needed medical attention. Because he came in when he did, his doctor was able to address it appropriately. Black, tarry, or visibly bloody stool can sometimes be associated with irritation, hemorrhoids, or certain foods and medications. It can also be associated with bleeding inside the digestive tract. If it happens once and resolves, mention it at your next visit. If it persists or comes with dizziness, weakness, or paleness, please don't wait. Contact your physician promptly or seek emergency care if you feel unwell. Coughing up blood is another one people often minimize. They'll say, "I think I just strained something coughing," or "it's probably my allergies." Sometimes that's true. A bad cough can sometimes cause small streaks of blood, especially if you have a cold or bronchitis. But persistent or unexplained coughing up of blood is something your physician should know about, especially if it continues for more than a day or two, or if you have any history of lung conditions or smoking. This isn't something to self-diagnose from a video. It's something to bring to your doctor so they can properly evaluate what's going on. Now, persistent, unexplained weight loss. This one sneaks up quietly. Clothes start fitting looser. Family members say, "You're looking thin. Have you lost weight?" And often, the answer feels flattering at first. Some people even joke about finally not needing that diet after all. I think of a woman named Betty, 80 years old, who lost close to 15 pounds over 3 months without trying. She told me she just wasn't as hungry these days. Loss of appetite can sometimes be associated with normal aging, stress, or grief. It can also be associated with other conditions that deserve evaluation. Betty's case turned out to be manageable once we understood what was happening, but we only found out because she finally mentioned it. If you notice you've lost a significant amount of weight without trying and you can't clearly explain why, that's worth bringing up at your next appointment, even if you feel fine otherwise. Let's talk about sudden confusion or personality change. Families often notice this before the person themselves does. Grandpa seems more forgetful this week. Mom seems unusually irritable or strangely quiet, or she asked the same question 3 times at dinner. Sometimes this can be associated with something as simple as poor sleep, dehydration, or a medication side effect. But sudden confusion can also be associated with an infection, a change in blood sugar, or reduced blood flow to the brain, and in some cases, it can be a sign of a stroke, which we discussed earlier. If confusion comes on gradually, mention it to your physician at your next visit. If it comes on suddenly, especially alongside other symptoms like weakness, slurred speech, or difficulty waking someone, that needs emergency evaluation immediately. And finally, fainting or loss of consciousness. People often explain this away easily. "I just stood up too fast. I think I was dehydrated. I probably just needed to eat something." And often, that really is the explanation. But I remember a man named Harold who fainted briefly while gardening. He felt fine afterward, brushed himself off, and didn't mention it to anyone for almost 2 weeks. It turned out his heart's rhythm had a temporary irregularity that needed his doctor's attention. A single fainting spell with a clear, harmless explanation, like standing up quickly, is often nothing serious. But any unexplained loss of consciousness, especially if it happens more than once, deserves a conversation with your physician. If it happens with chest discomfort, an irregular heartbeat, or confusion afterward, please seek emergency care. I want to say something clearly before we close. None of these symptoms are meant to frighten you. Most of the time when my patients come in with these concerns, the explanation is something simple and treatable. But I've spent 35 years watching what happens on both sides of this. The patients who came in a little early and the patients who waited just a little too long. The saddest words I hear in my practice are rarely, "Doctor, I was sick." They're almost always, "I thought I could wait until tomorrow." If something about your health doesn't feel right, please don't sit with it alone. Have the conversation, ask the question, see your physician. Tomorrow is never guaranteed, but today is always an opportunity to take care of yourself and the people who love you. If you found this video helpful, I'd be grateful if you'd like it, subscribe, and share it with someone who might need to hear this today. I'm Dr. Alan Mercer. Thank you for watching. Take good care of yourself, and I'll see you in the next video.